Hello and welcome to episode 13 of Pelvic Pain Unpacked. I'm your host, Tamer Hill, and I've got my trusty sister co-host and Dr.
Charity Hill.
Dr. Charity Hill, thanks so much. Today, we are going to be talking about men's pelvic health because you know what? Men hurt too. And they, we have focused a lot on women, but we really want to focus on men's pelvic pain. And so we want to basically get some education out there for men who might be starting to struggle with pelvic pain or have been given a diagnosis or haven't been given a diagnosis. So that's kind of where we want to kind of go with this. Does that sound good?
Absolutely. We're just putting information out there. Obviously, we're not providing medical care here, but we're trying to just give information and direction. If you've been struggling, it can help lead you hopefully to the right doctor to help you out.
You know what's so funny is whenever I talk to a doctor on this show, they always say that. We're not here to give out medical advice. This is we're just talking.
Information.
Absolutely. So, so I think, first of all, how many men struggle with pelvic pain? Because with women, we've said it's around 10%, probably higher, probably undiagnosed. But some of the stats we were seeing were anywhere from 4% to up to 20%.
Yeah, I will say when I tell people I do pelvic pain, people assume I have a clinic full of women. For my pelvic pain patients, it's probably about 60% men.
Really? That high?
I see more men than women with pelvic pain, and that's who's landing in my office. People, I think, assume men get better care in this realm, but honestly, I will say this is one place where we are equal. We are equally underserved in the pelvic pain world. And so a lot of men are like, but I never hear of men talking about this. And so this is one place where I feel like there's an inequality, is that I feel like women with other women are more likely to maybe share this information with each other.
I think they're definitely starting to, and men have just, Do you think that men, if they are having problems ejaculating, they're probably not going to go talk to their bros about it? Do you think they're going to go to their doctor faster about something like that than like a woman would? Because women are sadly trained to say, hey, once a month you're going to be in pain. So part of being a woman. That's kind of what women are.
Yeah, I see quite a bit of delay and hesitation of men seeking care for this as well, especially young men in their teens and 20s where they may not be visiting a doctor a lot anyways. And this is something that doesn't come up often. It's not something that's like screened for or asked about. And so I don't think a lot of people are coming forward with this, men or women.
Yeah. Oh, that's interesting. But you do have more male patients than you do female, which is interesting.
They do land in my office eventually.
So they're coming. They are coming out and trying to get some help. So a lot of men, and I see this on our website with men who comment on our products, a lot of them have this general diagnosis as prostatitis, which is an inflammation of the prostate, right? From layman's terms. But I think that's not really exactly what it is, right?
Yeah, prostatitis, I think, for some people may be the correct diagnosis. For the majority of people that come into my office with the diagnosis of chronic prostatitis, it's really chronic pelvic pain syndrome that they're battling, the dysfunction that we've talked about. Loop back to our chronic pain cycle episode.
Good episode. Got to go listen to that one.
About the pelvic floor spasm, about the neurogenic inflammation, about the kind of systemic dysfunction that happens in the pelvic region. With males, a lot of times the things that, kick up the dust that start this may be different than what starts it with males. So obviously, they don't have endometriosis, so it may be prostatitis or even a sexually transmitted infection or some other inflammatory disease or injury in that area that triggers it. Common ones I see are sports hernias or athletic pubalgia or labral tears in the hips that just kind of kick up enough dust or inflammation that it gets this pelvic pain cycle started. Other hernias like inguinal or obturator hernias or other things that we sometimes see. Um, and so while the cause or the initial trigger may be different, the syndrome is actually very similar in how it interacts with men and women.
Because men have a pelvic floor, women have a pelvic
Then-
floor.
yes.
That's in common. I mean, they have a prostate. We don't have a prostate.
We
But
don't have a prostate.
or women, I should say. Speaking as a woman, I don't have a prostate. I was not born with one of those. But you have other kind of things at play. Testicular pain. That would that go into chronic pelvic pain, or would that just be specific to testicular pain?
So obviously, whenever I see a male with pelvic pain, they have to see a urologist first because we have to make sure there's not something active going on
An
with the
infection.
scrotum or testicles, right? An infection, torsion, hernia into the like. I'm assuming when I've seen you, you've already had that ruled out. That's like step one. And so because there could be an initial injury with the testes or scrotum, assuming that's not it. And there is pain and very real and not in your head pain in the testicle. That's coming from that chronic pain cycle from the neurogenic inflammation. It's radiating or referred pain into the testicle, and it's real and it's bad. Sometimes for some people, it radiates into the skin between the testicle and the rectum. Sometimes it is in the testicle. Sometimes it's in penis, penile shaft.
So let's talk about some of the diagnoses that are pretty prevalent. And so the one you've already mentioned, which is chronic pelvic pain syndrome, CPPS. And then there's another one, just pelvic floor dysfunction in general, right? Another common one we hear is like penile neuralgia, prostatitis. Am I missing any other kind of common baskets in pelvic pain basket?
Those are I would say the general like categories you'd be placed into if you were a male complaining of this. And like I said, a lot of times there is an underlying condition or diagnosis. And sometimes we never find one. Sometimes we don't know what stirred it up. Or I have had some people, especially cyclists, were just, the sitting on a cycling seat kind of is the trigger that trips these things up. But what I really tell men too is to not get too caught up with the diagnosis and to focus more on like the whole person and the treatment of that whole syndrome, and tackling the multiple points of the chronic pain cycle, tackling the neurogenic inflammation, the muscle spasm, the muscle memory, kind of that what we want to do is, we call it pain reprocessing, retraining your brain how to get out of that chronic pain cycle.